So what are our procedures with oxygen? Well, you're going to start by removing the protective seal. All of the new bottles come with some sort of protective seal on them. Then you're going to quickly open and shut the valve on the top, and this is to clear out any dust and kind of to make sure that your tank's actually working okay. When you shut it back down, it should seal completely. You're going to attach the regulator and flow meter to the tank, and you're going to clear that out and check the reading, see what it says. Select the proper size of oxygen mask, size and type. You're going to attach the oxygen mask to the flow meter. You're going to open the flow meter to the desired setting, apply the device to the patient, and when complete, remove the device from the patient, turn off the device, turn off the regulator or the flow meter, and you're also going to remove all pressure from the regulator. And we'll talk about exactly how to do this in class. So I talked about the correct oxygen device. The first device I'm going to mention here is the non-rebreather mask. With this, up to 90% oxygen can be delivered. So this, and you'll see different things. Some of them will say 90 to 95. Some of them will even go as far as to say 99% oxygen by non-rebreather. And the idea here is there are these two little valves. They're just little rubber flapper gaskety things that are on here. When the patient breathes in, these valves close, and all they get, oh, there's a valve here too, and all they get is the oxygen that's plugged in. So the oxygen goes in. When they breathe out, this valve closes, and these open. So all of the stuff that they're breathing out goes out of the mask. And they breathe in, they get oxygen, they breathe out, all the CO2 goes out. So they don't rebreathe anything that they've already breathed out. You can see there's a reservoir here, there's a bag. One of the key things about the non-rebreather is this has to be full of oxygen before the patient starts breathing it. The flow rate should be adjusted so when the patient inhales, the bag does not collapse completely or really much at all. This is going to be about 15 liters per minute. The nasal cannula delivers between 24 to 44% oxygen depending on the flow rate. You can set it between 1 and 6 liters per minute. After that, it's not very kind to set it any higher because you're literally blowing this oxygen straight into the patient's nose. It goes into the patient's nose. That's a big nose. Wow, okay. Anyway, it goes right into the patient's nose. For each liter per minute of flow, the percent oxygen is increased by 4%. This is actually fairly well tolerated by patients as long as they're using their nose to breathe. It's not very useful for mouth breathers. A partial rebreather face mask. So this looks very similar to the non-rebreather, but you can see there's no valve covers. This is what those little valvey things looked like. It's just a spot that has a few holes, and basically you're going to breathe in air from the outside as well as oxygen from the reservoir. So this can deliver up to 60% oxygen at a rate of 6 to 10 liters per minute. This is pretty advantageous if the patient is hyperventilating. So if the patient's breathing really fast and there's not really a great reason for it, maybe they're anxious or upset, you can try this. It gives them the feeling that they're getting oxygen, but it's not giving them so much oxygen that it's going to be harmful for them. There are special tracheostomy masks, and this is for patients who do not breathe through the nose or the mouth. You can actually use a non-rebreather if needed. That's going to blow enough oxygen that the patients are going to be able to breathe okay through their trach. Another device is a Venturi Mask. You'll see these in the hospital setting, but they don't tend to be carried outside of the hospital, mostly because of the cost associated with them. This is going to provide a precise concentration of oxygen. So it's a mask. It has these different colored little valves that you kind of stick in here, right in there. And it's going to basically mix the oxygen coming in with the air from the outside to create a precise concentration of oxygen between 24 and 40%. This is going to be useful in long-term management of your patients. You may see these in like rehab facilities. Humidifiers. So one of the problems with giving oxygen is that it's dry. It comes out of the tank and it's dry. The air that we breathe is humid. You can even check the weather report and see what the percent humidity is. You know, low around here is going to be in the 20%. And our patient is, you know, going to end up breathing this dry oxygen. So you want to take and humidify it if you can, or especially the patients with long-term oxygen therapy. It helps prevent drying of the membranes. And if you have a really long transport, like hours, you want to consider using humidified oxygen. Well, that's about it for the airway and breathing lecture. Thanks for your attentiveness, and I look forward to seeing you in class.